Hello. Are you hypertensive or experiencing episodes of high blood pressure? Are you worried and want to find out which are the best foods to reduce pressure naturally and which foods should be avoided in your diet? That's the topic of today's video. We are going to cover the 10 best foods for hypertensive patients, which you should include on your plate, and the 5 forbidden or most dangerous foods for those who have hypertension, prehypertension, or want to avoid increasing blood pressure. Therefore, I ask you to stay until the end of the video. We know how important it is to receive valuable information about caring for our greatest asset in our life, which is our health. But before you go any further, please enjoy the video and subscribe to the channel if you are not already subscribed. That way, you won't miss our health tips. Also, I ask you to share this video with as many people as possible through social media. Let's spread this information to a large number of people. So please share it. And tell me, do you suffer from high blood pressure or have pressure spikes? Do you want to know how to improve it? What part of the United States or the world are you from? Write below in the comments. Let's go. Diet is directly related to high blood pressure, of course. Food has a close link with blood pressure. Some foods can increase pressure, while others have the power to lower it naturally. Remember that hypertension is one of the most common health problems worldwide, affecting 1 in 3 adults. And we know that lifestyle changes such as weight loss, exercise, dietary changes, especially the DASH diet, which I will talk about later, as well as reducing salt intake, and the use of medication can improve or control pressure. We know that a systolic blood pressure constantly above 120 millimeters of mercury already causes vascular damage and increases cardiovascular risk. What are the symptoms of hypertension? Most of the time, hypertension is asymptomatic. It has no symptoms. How many people go to the doctor's office and have a checkup and found out that they had pressure 18/11 without feeling anything at all, being surprised? So beware. High blood pressure does not cause symptoms. It is a silent disease. Sometimes the first symptom is a stroke or a heart attack. However, there are exceptions. If you are hypertensive and take medication, you may feel when the pressure rises, as you may experience a headache in the back of your head, shortness of breath, redness in your face, blurred vision, dizziness or ringing in your ears, or even chest pain. Yes, these can all be symptoms of hypertension, although in some cases the pain may have caused the pressure to rise. However, it is true that some people feel the symptoms more than others. However, if you don't feel anything, it doesn't mean that you don't have high blood pressure. It is necessary to measure your pressure to make sure that you do not have this problem. And you don't know how important this is. This is because hypertension can cause complications. As I already mentioned, stroke, the main cause of strokes, both ischemic and hemorrhagic, is high blood pressure, heart attack, angina, heart failure, hypertensive cardiomyopathy, atrial fibrillation, dementia, aortic aneurysm, chronic kidney disease, sexual impotence and cardiovascular death. Therefore, it is important to know if you are hypertensive and to control your pressure to keep it within the normal range. Pressure control does not guarantee that you can be without pressure medication. In some cases, it is possible to keep the patient without drugs, but in other cases, it is necessary to resort to them. However, one important thing I want to emphasize is that fortunately there are medicines available. And antihypertensive drugs are getting better and better, with fewer side effects. So if you are averse to or afraid of taking pressure medication, but not afraid of suffering a stroke with all its consequences, think twice. Is there a diet that can fight high blood pressure? Yes, the DASH diet, which stands for Dietary Approaches to Stop Hypertension, in free translation would be Dietary Approaches to Control Hypertension. The DASH diet is an extremely healthy eating pattern that has been considered for many years the best diet in the world. In 2021, DASH is surpassed only by the Mediterranean diet. What does the DASH diet consist of? It emphasizes eating fruits, vegetables, whole grain foods, oily fish rich in omega-3s, skim dairy, nuts, and vegetable oils such as olive oil. In addition to incorporating these foods into your diet, you should reduce your consumption of red meat, or opt for lean cuts, and avoid sodas or boxed juices. The DASH diet aims to increase your intake of potassium, magnesium, calcium, protein and fiber, which are minerals that help lower blood pressure. The DASH diet has the power to prevent and even reduce blood pressure, albeit to a lesser extent than a stronger antihypertensive medication. Making it easy for you, here are the foods you should eat on the DASH diet. 1. Consume 2 to 3 servings of skimmed dairy a day. 2. Consume 4 to 5 servings of fruit per day. 3. Consume 4 to 5 servings of vegetables, giving preference to leafy and root vegetables. 4. Consume 6 to 8 servings of whole grain foods, such as brown rice, whole grain pasta, flaxseed, chia, nuts and whole grain breads. 5. Avoid processed foods and sugar. By following this menu, you will have a balanced, nutritious diet that will help reduce blood pressure. After watching this video, I will leave you with a playlist that will help you better understand the impacts of sugar and guidelines on how to reduce the consumption of this ingredient so present in our food. Now, let's specify a little more about the 10 best foods for a hypertensive, which is the main theme of the video, and the 5 worst foods you should avoid. The 10 best foods for hypertensives are: Number 10. Banana. Bananas are rich in potassium, a mineral that reduces the effects of sodium and helps relieve tension on blood vessel walls. One medium banana contains about 420 milligrams of potassium. Other potassium-rich fruits include oranges, tangerines, melons, plums and avocados. Number 9. Watermelon. In addition to potassium, watermelon contains citrulline, which assists the body in producing nitric oxide. Nitric oxide relaxes blood vessels and stimulates the flexibility of arteries, which can reduce high blood pressure. Number 8. Kiwi. A study of hypertensive patients and smokers showed that consuming 3 kiwis a day promotes antihypertensive effects, reducing both systolic and diastolic pressure by about 8 to 10 millimeters of mercury. Kiwis appear to inhibit angiotensin-converting enzyme, which contributes to their antihypertensive effect. Number 7. Red fruits. Red fruits such as blackberry, blueberry, strawberry, and cherry contain anthocyanin, a type of flavonoid. Anthocyanin improves endothelial function, which plays an important role in blood clotting and blood pressure regulation. In addition, studies show that berries can improve cognition and brain function. Number 6. Pomegranate. Pomegranate has the ability to reduce blood pressure in the short term through 3 mechanisms: high potassium content, presence of anthocyanin and inhibition of angiotensin-converting enzyme, just like kiwi. Despite being a bit expensive, it is an excellent option. Number 5. Dark chocolate. A Harvard University study showed that consuming a square of dark chocolate with more than 60% cocoa can lower blood pressure and improve insulin sensitivity, reducing the risk of diabetes. Prefer dark chocolate over milk chocolate and opt for options with lower sugar content. Number 4. Beetroot. Research shows that drinking 250 milliliters of beet juice lowers blood pressure in people with hypertension, showing positive effects already in the first 24 hours. Blood pressure can decrease by about 8 millimeters of mercury after drinking beet juice, bringing it to the normal range. In addition, beet is also used as a supplement for athletes, as it helps in recovery and improved performance. After watching this video, I will leave in the comments 2 must-see videos about the benefits of beets for your health. Number 3. Garlic. garlic contains allicin, a compound that can increase the production of nitric oxide in the body, helping in dilating the arteries and lowering blood pressure. In addition, garlic enhances the flavor of food, allowing you to reduce salt consumption. Regarding garlic, there is also a video here on the channel that I will leave fixed in the comments about the consumption of garlic and the effects on the organism in a different way that many people liked, but watch after watching this one in full. Number 2. Natural yogurt. Studies show that middle-aged women who consume 5 or more servings of yogurt per week have a 20% reduction in the risk of hypertension. Yogurt is rich in calcium, which helps regulate blood pressure, and contains natural probiotics that contribute to overall health. Opt for unsweetened yogurts, such as plain or Greek, and add fruit to enhance the benefits. Number 1. Lentils. Lentils are an excellent source of fiber, potassium, magnesium, folic acid, and protein. Several studies have shown that lentils help reduce blood pressure. Now, let's talk about the 5 foods you should avoid. Number 5. Cucumbers and pickled foods. These foods are high in salt as they absorb a lot of sodium during the preservation process. A small pickled cucumber contains about 450 milligrams of sodium. Number 4. Cold cuts and cured meats. Salting and curing meat involves the use of salt, nitrites, nitrates, sugar and seasonings. Salt and sugar increase blood pressure, and nitrites increase the risk of stomach and bowel cancer. Therefore, it is better to avoid them. Number 3. Canned soups. Canned soups are high in sodium. The same is the case with packaged soups. If you like soup, prefer to make it at home, using fresh ingredients, vegetables and greens, and avoid adding too much salt. I am sure it will be tastier and healthier. Number 2. Tomato sauces. Most canned tomato sauces and tomato pastas contain high sodium content, which can increase blood pressure. When buying these products, check the labels and choose the ones with the lowest amount of sodium. Number 1. Soy sauce and ketchup. People with high blood pressure should avoid all condiments, including soy sauce and ketchup. It is important to check labels as some products may contain high amounts of sugar or sodium. Even condiments that seem less salty may contain large amounts of these substances. In addition, it is important to avoid excessive consumption of alcohol, sugar and cigarettes, as they can all increase blood pressure. Remember that physical exercise, weight loss and stress reduction also have a positive impact on blood pressure. Remember to always consult your doctor before making significant changes to your life, especially if you have pre-existing medical conditions. Take advantage of all the tips and take care of your health in an integral and balanced way. Did you like the video? Remember to share it so that more people can have access to this information. I will leave 2 relevant recommendations for you: our playlist on diabetes, one of the most complete on the subject, and our playlist on hypertension. Don't forget to subscribe to the channel to receive more content like this. Thank you very much.